Hi, I'm Tony Boba and I'm in the nursing program here at Wilson State College, and today I'm going to be performing my postpartum assessment. I've already checked my patient's MAR and her electronic record, and then I'm going to go in and I'm going to assess my postpartum patient. So first thing I would do is knock on the door and introduce myself, and so I'm going to go in the room. Hi, I'm Tony and I'll be your nurse today. And so I'm just gonna go ahead and have you verify your name and date of birth for me. Perfect, perfect. I just want to make sure I had the right patient. How are you feeling today? Good, you got a little bit of pain? Okay, can you rate your pain on a 0 to 10 scale for me? It's about a 4. Okay, can you tell me where that pain is today? It's just right in your upper abdomen. Okay, that's probably completely normal. That's probably uterine pain. And can you tell me your, and if you're having any problems with your vision after having baby? Do you see any halos when you're looking at the lights? Do you get any headaches, any dizziness? No? Okay, good. And then I also did check your chart and your vital signs looked good this morning, so everything is good with that. And so what we're gonna do is we're gonna go ahead and just go through complete head to toe, checking you all out, making sure everything looks okay. And I might be exposing you a little bit when I do this, and so would it be okay if I asked your family to leave the room at this time? Okay, I'm gonna go ahead and have the family leave the room. And so after they left the room, I come back. And so next thing I want to ask you is, have you had been up to use the bathroom and you urinated since you've had baby? Yes, you have. Have you had any burning or any hard time going at all? No? Okay, good. And then have you had a bowel movement since having baby? No? Okay, well, the doctor's ordered you some DocuSafe sodium, and so that's just a stool softener to help you go. It's nothing to worry about. So next time you have your pain meds, it'll probably come in with your pain meds. And then have you had any flatulence at all? Yes, good. That's what we need to know, so everything just keeps moving. Okay, so first things first, what I'm gonna do is I'm going to check your breasts. And I noticed that you don't have a sports bra on, so I'm just going to suggest when between feedings that you have a sports bra, good support for that, okay? And so first things first, I'm just going to check your breasts on both sides. I'm going to check your skin and make sure it looks good, and check your nipples because you're breastfeeding, correct? Yes, okay. All right, so we're just going to go ahead and check. No tenderness? Okay, good. I do see some cracking on this one, and so we have a cream that we can help you with that. The cracking, and it's safe for you, it's safe for the baby. You can put it on between feedings. Any tenderness with this one? No? Okay, good, good. And all her skin looks good, and there's no major redness or swelling other than the normal swelling when you're breastfeeding. And then so what I'm going to go ahead and do next is I'm going to come down to your abdomen and I'm going to check your C-section scar, okay? And so I'm going to lay your head back first. Are you comfortable? Good. Okay, just want to double check and make sure. So I'm going to go ahead and roll your sheets down, and we're just going to check your C-section scar, okay? All right. All right, I see it's been glued, and so that's a good thing. I don't see any abnormal redness. It's totally normal to have a little bit of redness since it's a new wound. And when you go home, I just want to make sure, like, if you see any major swelling in the next few days after going home, or you see any drainage coming out of it, to notify your provider, okay? Okay, so next thing I'm going to do is I'm going to go ahead and I'm going to massage your uterus, and we are going to check for any for drainage coming out, which is completely normal. And we just want to make sure that your uterus gets hard as we massage it, okay? So I'd pull down her underwear and check. So it looks like there's about a moderate amount on your pad. Can you tell me the last time you changed your pad? Okay, it's been about 4 hours ago. Okay, so this is a good amount for 4 hours. Would you like me to change your pad for you today? Because I can do that. Okay, we can go ahead and change your pad. So I would change her pad. We'd do the drainage first and then change her pad. So I would massage, put my hand here and massage her uterus right below the umbilicus, just making sure that it firms up and then it's below the umbilicus where it should be in location. And so then we would change your pad. All the things looked completely normal with drainage coming out. Doesn't look like you have too much, and I didn't see any abnormal clotting going on. There's a couple of clots. So when you go home and if you have any clots that are bigger than an egg size, notify your provider. Also, if you notice any odor, or if you notice your lochia, which is the blood that comes out, if you notice that going from pink or clear back to bright red, then I want you to notify your provider as well, okay? Also, if you have a fever over 100.4, that's a good indication to call your provider as well, okay? Okay, so I go ahead and put this back down, and then I'm changing from a C-section patient to a vaginal delivery patient. So I would go ahead, hand sanitizer, and put gloves back on. And so what I'm going to do next is I'm going to go ahead and I'm going to just assess your perineal area and make sure everything looks good. It looks like she's got a little bit of swelling in here, but that's completely normal. Does it feel painful? Okay, I can bring you in an ice pack if that would help. Absolutely. We will bring that in the next time I come in with your ibuprofen and your lanolin cream, okay? Okay, so we'll do that. And then I'm actually just gonna go ahead and I'm gonna have you roll over and I'm gonna check where your laceration is, also call it an episiotomy, which is just helping with delivery. And so we would go ahead and I'm gonna have you roll over. Okay, so I see that the laceration, it looks completely normal. There's no excessive swelling, no drainage, no pus. Everything looks good. And I see you do have some hemorrhoids. Have they been there before? They were there before you delivered. Okay, I just wanted to double check and make sure. Are you having any pain with them at all? No? Okay, perfect. And so then change my gloves again. And so I'm gonna actually go ahead, hand hygiene, and gloves. I'm gonna go ahead and just check your legs for any swelling. Do you feel like you have any swelling in your legs? Okay, yep, that's completely normal to have swelling from a vaginal delivery in your legs for a little while. So we'll go ahead and just double check this. Okay, so I'm gonna bring your sheet down just a little bit more. Okay, no pain? Okay, good. It looks like she has about a 1 to 2 plus edema in her bilateral lower extremities. Ankles don't look like they have any edema, and the feet were about a scant to 1 plus edema in there. And your pedal pulses look good, which is the pulse on top of your feet. They feel very well, and you've got good pulses here as well. Okay, go ahead. Cover back up. And how are you feeling with your bond with your baby? Do you feel pretty good about that? Yeah? Okay, good. How are you feeling about breastfeeding? Do you feel like it's a good attachment? Good. Are you feeling any sadness or feeling down at all? No, that's good. Good. Well, just so that you know, it's completely normal to feel a little bit sad after having baby. It's called baby blues. It usually happens for a couple of weeks, so if it does happen, that's fine. If anything becomes worse where you feel sad or you feel like you just don't want to be around anymore, or if you feel like hurting yourself or your baby, then you need to call your provider because that might be start of postpartum depression. And so we want to make sure that we help you with that, okay? There's also a few classes about breastfeeding around. If you'd like to have a referral to that, we can absolutely give you the information for that. Is there any other questions you have for me before I leave? No? Okay. Everything else looks good. If we have any issues whatsoever, just give us a call and we'll be back in the meantime. So I will go ahead and go get your ibuprofen and your lanolin cream and an ice pack for you, okay? Perfect. So I would just make sure she's comfortable, call it is in reach, and then I would do my hand hygiene, go out of the room, document, get her stuff and bring it back to her.